So based from my experience in the delivery area or in the DR, and with my sharing experiences among students, newborn care is actually the initial assessment. This is also the initial workup and what we call initial pediatric exam. In some private hospitals, there are actually pediatricians who are the one who will assess for the newborn. But basically in most of the hospitals, there are midwives and other skilled attendant who needs to attend for the newborn. For the importance of a newborn care, actually 70 to 90% of the mortality rate among death of our newborn, actually the causes of this are asphyxia and infection. That's why it needs a thorough assessment for this newborn. Okay. Another routine newborn care, which is actually 1 to 3 minutes after the delivery of the baby, is properly timed cord clamping. And then after the umbilical pulsations have stopped, what you're going to do is clamp the cord using a sterile plastic clamp or tie at 2 centimeters from the umbilical base. And then clamp again at 5 centimeters from the base, and then cut the cord close to the plastic clamp. Few minutes after the delivery of the newborn, wherein we consider this as the crucial stage, wherein the nurse or the skilled attendant should assess thoroughly the newborn to perform the essential interventions, especially if the newborn really needs resuscitation or enough oxygenation. Maybe the newborn is suffering from asphyxia or infection, like for example due to thickly meconium staining or a fetal distress. That's why there are preparations that you have to do during the newborn care. For example, first and foremost, you have to assess the adequate birthing pattern that must be established. The preparations and prior doing the procedures of newborn care, make it sure you have to have your hand washing. This is before and after. And then you should not forget to wear your sterile gloves, donning of your gloves. Okay, so first, suctioning. Actually, you have to prepare for the suction machine. If there is no available for suction machine, you can have your bulb aspirator. Okay, of course, this is important if a patient or the newborn is suffering from asphyxia, or probably the baby suffered from thickly meconium stained. And then oil bath. Usually it depends on the hospital policy. It's either with or without bathing, water bath or oil bath, because they believe, and this is a new memo of World Health Organization, that no need to remove the vernix gaseosa because it may help on the preventing to the newborn for certain infection. And then second, weighing and anthropometric measurements at the same time. So we have to measure the head circumference, the chest circumference, the abdominal circumference, and the length of the newborn. And then another procedure is the Vita-K injection, which you have to give IM at vastus lateralis. Usually it's 0.1 cc. Rationale for this, since the newborn's GI tract is still sterile, so the intrinsic factor, the clotting factors such 2, 7, 10 are still missing, wherein it cannot synthesize the vitamin K. So we have to give, or which is part of the routine newborn care, is giving the synthetic Vita-K to prevent for certain bleeding conditions of the newborn. Another, though, again, it's a new memo for the essential newborn care is the footprinting. But in the other hospitals, footprinting is still needed. They say or they believe that with the use of the stamp pad, it may transfer cross-contamination of certain infection. Pero for some identification, for identification purposes, footprinting is still important. Although there are hospitals that they don't use it anymore. Another is for legality, we should not forget is the name tag, okay, or the ID. You have to put there the gender, the time of the delivery, the name of the mother, the hospital, and the date. You should write all of those important data. Another procedure, documentation, which is important, wherein you have to write the important data, the time, the date of the delivery, the APGAR scoring, the attending physician, the type of the delivery, the name of the mother, and if the newborn care rendered, you must have your checklist or check down all of the bathing, injection, thermicin ointment, if the initial immunization has also been given. And then another one is providing warmth. Another procedure. And you have to prepare for a blanket or other baby slayette. Providing warmth is also important because drying the baby thoroughly, wherein by applying and putting on the blanket provides sufficient stimulation for breathing. Wherein another thing is latching together with the mother, or what we call the skin-to-skin care or the kangaroo care. So that's initial also bonding between the mother and the baby. Another one is APGAR scoring. APGAR scoring is also essential for our routine newborn care, wherein it also applies 1 minute and after 5 minutes after birth. This is actually to determine for the newborn this is actually to assess the entire or the totality of the health of the newborn, to assess the newborn if there are some neurological problem. Although to discuss for the APGAR scoring, it was actually devised by Dr. Virginia APGAR way back in 1952 as a simple and replicable method to quickly and summary assess the health of the newborn immediately after birth. So APGAR was an anesthesiologist who developed the score in order to ascertain the effects of obstetric anesthesia of babies. Which is appearance, pulse, grimace, activity, and respiration. So for the appearance, you have to assess for the skin color, for the pulse, for the heart rate, and then for the grimace, the different reflex irritability or the reflexes, and then activity, you have also to assess for the muscle tonicity and respiration. If you're going to ask for some important considerations on doing any procedures, basically, you have to determine the different cultures of your patients or your clients, because culture play major role to identify factors among people culturally, linguistically diverse backgrounds, which may affect their use of antenatal services, their care during pregnancy, labor, and birth, and even after or postnatal care. So meaning to say, you should communicate with your clients regarding their practices, or else they might have this practices which are different from the practices among the common. While doing the procedure, at the same time, you are also assessing. So you can actually assess for some complications of the newborn. Like for example, you are changing or putting on the clothes of the newborn, and then you have assessed for some defects, or doing a procedure like for example you are suctioning, and then you have assessed for some cleft palate or cleft lip. Okay, or this is also considered as congenital anomalies. Another complication that you can assess are the birth injuries caused by the large babies, cephalopelvic disproportion, prolonged labor, or what we call the birth trauma caused by the, for example, forceps delivery. So wherein you can actually refer it right away. And even the transient tachypnea of the newborn, because this is a term wherein it is a mild respiratory problem and it lasts for hours or even days, wherein it is thought that it's low of the fluid in the fetal lungs cause the tachypnea. This fluid makes taking in oxygen harder and the baby breathes faster to compensate. That's why nurses again must be very good on assessment, wherein once you found for some complications as such, you can refer it right away. Importance of breastfeeding. Actually, there are importance and health benefits for both mother and a baby. Okay, breastfeeding is actually the initial bonding between the mother and a baby while latching the baby on the chest of the mother. Okay, and then there are also researches that babies who are fed breast are actually have the lower risk of, first, gastrointestinal illnesses, because lactoferrin actually coats and protects the lining of the intestines of the baby. And among prematures, it may also prevent from necrotizing enterocolitis. So that's the first benefit. And then other one, it may also prevent or protects the baby from some allergens and asthma. Because on the studies, colostrum, or the golden fluid from the human milk, as we considered, it has rich also in antibodies that capable to alter and fight allergens and even germs and other bacteria which are also present in the environment after the baby was born. Another one is different forms of infection. Since it has an antibodies, it may also again protect from different infections. So another advantage for the mother of the breastfeeding, it assists the uterus return to its pre-pregnant state faster. And then it has also an economic advantage, and they believe that mother less likely to develop osteoporosis. That's why breast milk is widely acknowledged as the most complete form of nutrition for infants, with a range of benefit for infants' health, growth, immunity, and development. Newborn screening is a public health program which aims at an early identification of infants who are affected by certain genetic and metabolic conditions. Early identification and timely intervention can lead to significant reduction of mortality and morbidity and associated disabilities in affected infants. Meaning to say, newborn screening in the Philippines started actually June 1996 and was integrated in the public health delivery system in the enactment of Newborn Screening Act of 2004, Republic Act 9288.